Hello, I'm Dr. Harrison Wright, a specialist in geriatric health. And today, I want to ask you a very personal question. Can you remember the last time you got out of bed and just stood up? No wincing, no grabbing the nightstand, and no waiting for your knees to warm up before you could walk to the bathroom. For many of you, that simple act has become a daily negotiation with your own body. You feel like your knees are stiff, achy, and creaky like an old wooden door. And what breaks my heart is that so many people accept this as a normal part of getting older. But I am here to tell you today that this morning stiffness is not a life sentence. It is a signal that your knees need attention. And the best time to give them that is the very second you open your eyes. Before we start this rescue plan, I want us to make a commitment together. If you are tired of feeling like your knees are 20 years older than you are, tell me in the comments. Please, write right now. Doctor, my knees are going to feel young again. By writing this, you are making a conscious decision to stop settling for pain. Pause. To start healing, we have to understand that your joints are like a cold engine. While you sleep, your synovial fluid, the natural lubricant inside your knee, thickens like honey in a refrigerator. This is why, before your feet even touch the floor, we are going to perform 2 essential exercises right there in your bed. We begin with the bed heel slide. While lying on your back, slowly slide your heel along the mattress toward your glutes, and then slide it back out. The mattress is your best friend here because it supports your leg and reduces friction, allowing that synovial fluid to warm up and become slippery again. Once you feel that motion becoming smoother, we move immediately to waking up the muscle that actually protects the joint, the quadriceps. Still lying down, simply push the back of your knee down into the mattress, tightening your thigh as hard as you can for 5 seconds. This is an isometric contraction, and it is the safest way to turn on your natural knee brace, so that when you finally stand up, your joint doesn't have to absorb all the impact. Now that your muscles are awake, it's time to sit on the edge of the bed for the next step, which is the seated knee extension. By straightening your leg out in front of you and giving it an extra squeeze at the top, you are building the functional strength you need for walking and climbing stairs. But don't stop there. Once you stand up, I want you to use a wall or a chair for support and perform gentle knee circles. By moving your knees in slow, smooth rotations, we are compressing and releasing the cartilage from every angle, ensuring that the lubricant reaches every corner of the joint and eliminating those clicks and pops you often feel. This leads us to the most important exercise of all, the one that almost everyone ignores, but is the key to stability, the wall-supported mini squat. By sliding down just a few inches, we are specifically targeting the VMO, that teardrop-shaped muscle on the inner side of your knee. If this muscle is weak, your kneecap tracks improperly and grinds against the bone. But by strengthening it, you pull the kneecap back into its proper groove, and the pain decreases dramatically. You only need to hold that shallow bend for 10 seconds to feel your VMO waking up and taking control. But the work doesn't end with physical movement. As a doctor, I know that your cartilage has no blood supply of its own and relies entirely on hydration to stay healthy. This is why, after you finish your exercises, I want you to incorporate my 60-second bonus protocol. Drink a full glass of room temperature water while doing slow ankle circles. This replenishes your fluids and ensures that your hinges are well oiled for the rest of the day. By following this complete sequence every morning, you are moving from neglect to total care. I see it every day. People in their 70s and 80s who started with stiff, painful knees, and within just 2 weeks of this routine, are walking with confidence again, playing with their grandkids, and taking the stairs by choice. Your knees are not broken. They have just been neglected. My challenge to you is to try this for 7 mornings in a row and come back to this video to share your progress. If this information has given you hope, please hit the like button and subscribe to join our health community. Don't forget to leave your comment. Doctor, I accept the 7-day challenge. Your consistency is the bridge between stiffness and freedom of movement. I am Dr. Harrison Wright, and it has been a pleasure talking with you. I'll see you in the next video.